There's been an alarming hike in sexually transmitted infections across WA. Doctors say it's not just young people contracting the illnesses, but seniors too. In just a decade, the number of gonorrhea cases has more than doubled and syphilis cases more than tripled. So to discuss this further, let's bring in our resident doctor, Tamara Hunter. Welcome, Tamara.
Hi, Emmy.
Now, what's behind this increase?
Well, it is interesting to see in that the recent surveillance report says that gonorrhea cases is up over 18,500, which is 8,000 more than was reported 10 years ago. As you said, chlamydia, a rise of 43% there. Look, certainly population numbers have increased, but I suppose detection rates are increasing as well, which is somewhat reassuring, but this needs to happen a little bit more in men. Women often get opportunistic testing when they go for women's health checks, but because STIs are largely asymptomatic, then it's really important for us to be pursuing more opportunistic testing, particularly in men.
So tell us more about the age groups you see with STIs. Now, ordinarily, we'd think it's the younger generations.
Yeah, certainly the incidence is higher amongst younger populations. In fact, 77% of chlamydia cases are found between the ages of 15 and 29, and that's largely due to having multiple sexual partners. But interestingly, the rise has also happened in older populations as well. And perhaps the whole safe-sex message is more about pregnancy, and that's what people are hearing, and perhaps that's not as big an issue in an older population. And so maybe we should be changing the health strategy a little bit more and talking about the importance of STIs in older populations as well.
Now, these STIs can actually have some serious and long-lasting impacts on our health.
Yeah, absolutely. STIs can lead to something called pelvic inflammatory disease, which is the ascent of bugs into the pelvis, the reproductive organs, and for women that can lead to fevers, pain, and even abnormal bleeding. But the bigger implication is particularly with asymptomatic infections that go untreated, that can lead to blockage and scarring in the fallopian tubes that can ultimately affect fertility. And it's not unusual to see a woman who presents with a history of chlamydia infection with infertility to end up requiring IVF to conceive.
Okay, it might seem obvious, but what should people be doing to protect themselves?
Look, Emmy, it's a really simple message. The first step is prevention. Use barrier contraception, that's condoms. And the responsibility needs to be both within men and women as well. And the second step is early detection. Take every opportunity to get an STI check. It's quick, it's simple, it's really easy and non-invasive, and the treatment is also really simple as well. So if you are concerned or if you do have questions, sit down with your general practitioner, and it doesn't matter how old you are.
And how often then should you be doing this? Does it depend on, I guess, how sexually active you are?
I certainly think if you're with a new sexual partner, it's a good practice. Women will routinely get offered at their pap smears, but if you've got any symptoms whatsoever, definitely sit down with your doctor and talk about it.
Okay, thanks for that, Dr. Hunter. Have a great weekend.
You too.